Hello, everybody. Welcome to our third installment of Finding Your COVID Balance. And we would like to thank you all for joining us this evening. And we hope that this provides you some comfort and guidance as we go into this next COVID chapter. My name is Tracy Curtis. When we started this series months ago, it was clear that we as a population needed more information, a safe place to get that information and to ask questions. And so that's how this event started months ago. So this series is free. We wanted to make it accessible to everybody, but the panelists that we have today, the amazing panelists today, do have a couple of favors from you. So one is if you are financially able, as this is a free event, Anne-Marie is the founder of a charity called Bracelet of Hope that was founded over 10 years ago that actually I'm the chair of the board of. And in March of this year, we launched a mobile health unit that was in Lesotho, Africa. There we were testing and treating people for HIV as well as maternal health with children and mothers. So, but on March 13th, things changed, and now they are also testing for COVID and educating the public with the COVID. So if you are able, Anne-Marie is requesting that you make a donation to Bracelet of Hope to say thanks. That is, our website is www.braceletofhope.com. Thank you very much if you're able to do so. Second thing is we want to remind you, Marva, Wisdom, and Anne-Marie and I are all three of us are Rotarians. And this winter, we have our regular Sparkles in the Park in Guelph at Riverside Park, and that is going on. So we wanted to make sure that you know that Christmas is not canceled. There's still lots of fun things going on in the community, and to make sure that you get out there and experience those safe things that you can with your families. And Sparkles in the Park is a beautiful way to do that. The third thing that we wanted to bring home was that to shop local this Christmas. So we know that things are tightening. We must support our local businesses, restaurants, and shops. So instead of just kind of going to Amazon, and we know that that is so easy, perhaps let's just take the extra little step and research what's close to us that we can support and buy from locally just to support those business owners. I think so fondly of all of our businesses. So just make sure that you're checking out your Downtown Business Association, local Facebook groups, and perhaps your Chamber of Commerce, and research on what's in your area and support those local people that are close to you. And the fourth thing is, most importantly, stay kind, be patient, and full of grace with each other. We need to be there for encouragement for our fellow neighbor, business owners, shop clerks, and family. Send a note of encouragement for the person in need. Little random acts of kindness will go such a long way during these winter months. So that's our four things that we would like to ask of all of you tonight. So we think that the name of Finding Your COVID Balance is perfect because my balance is going to be different than yours. And we all need to find our own balance to keep ourselves mentally and physically healthy. So Marva Wisdom is going to be our moderator for this evening. Marva is a focuses in senior equity and inclusion practitioner and a leader in our community. So before I introduce Marva, I would like to do a land acknowledgement. So as we gathered here, we are reminded that Guelph is situated on treaty land, that it's steeped in rich Indigenous history and has been home to a variety of peoples over the millennia. While today, this area has become home to many First Nations and Métis Inuit people. As a community, we have the responsibility for the stewardship of the land on which we live and work. And today, we acknowledge the historic Mississaugas of the Credit, the First Nations people who were treaty signatures to the territory for which we are meeting. So Marva Wisdom, I'm going to take it over to you, my friend, and look forward to hearing the panelists, and we'll see you at the end. Thank you.
you, Tracy, and thank you for your leadership. It really is an honor to be a part of this group and doing this work on behalf of our community. I have enjoyed Sparkles in the Park myself, so I'm glad that you mentioned that that would be a great way to stay safe because you can drive through in your car with your families. Each month, Anne-Marie and Helen will be the two panelists answering your questions about the mental and physical implications of the COVID-19 pandemic. Anne-Marie Zajdlik is a primary care physician in Guelph. She provides comfort and guidance to thousands during the pandemic. Anne-Marie's become a Facebook sensation with her daily posts of encouragement and sound scientific knowledge about COVID-19 and other health issues. Helen Fishburn is the Executive Director of the Canadian Mental Health Association of Waterloo Region. And Helen is a lifelong advocate for increased awareness of mental health issues and has dedicated her career to advancing the design of an improved mental health care system for all of us. Joining us, and this is a real privilege and honor for all of us. We love all our guests, but this guest is extra, extra special, hence our extra special event tonight. Dr. Nicola Mercer. Dr. Mercer is the Medical Officer of Health for Wellington-Dufferin-Guelph Public Health, and she'll tell you a little bit more as we get into this tonight. We're very happy to have Anne-Marie, Helen, and Nicola joining us as our panelists to take your questions tonight. These experts value the time they're spending with you, and we look forward to hearing from them. A few housekeeping rules before I ask Dr. Nicola to speak a little bit as an introductory to you. Housekeeping rules tonight, you may be joining us either on Zoom webinar link or via our Facebook Live broadcast. We are ready to receive questions for either platform. So we want you to feel free to type your questions into the Q&A section of either Zoom or Facebook, and we will do our best to answer all of your questions tonight. But if we can't, we will endeavor to follow up with the answers to you, and that will be on Facebook afterwards at some point. We're recording this webinar, and it will be posted on the CMHA Waterloo Region, so that's Canadian Mental Health Association Waterloo Region's webpage, as well as the Bracelet of Hope webpage, and on Anne-Marie's Facebook pages. And you can access all of this after this webinar is over. So let's start the discussion. And what I'll start with is a wonderful letter that Dr. Mercer sent to our community. And I want to ask her tonight, what prompted her to send this letter to our community having to do with COVID-19? And what are some of the high points of that letter? Dr. Mercer.
Thank you, Marva. Privilege for me to be here today. I'm just going to pull up the letter so I can see it in front of me. Actually, it was really something that was on my heart for a while before I wrote this letter. I was becoming increasingly aware that sometimes our messages in public health are confusing. Sometimes we can't quite put what we want people to do in very plain language. And sometimes, and it's all of us in healthcare, the messages are hard and ones that people don't want to hear, especially right now with COVID-19. So when I wrote this letter, I really wanted to try and point out the #1 behavior that is really causing the most community cases that we have. And that is a behavior that is probably the one that the most of us don't want to stop. And that is socializing with our friends and family. So as I wrote the letter, I specifically wanted to identify that that was what was happening. So when we talk to people and when we find positive cases, we try to do a look back to see where could they have got it from. And the #1 thing that we saw was what we would call a private social gathering, such as birthday parties, sleepovers, play dates, coffee dates, game nights, dinner parties, parties in general. And almost always those were the root cause. Sometimes people don't want to tell us what they have done or where they've gone, but really it was people getting this virus from friends and family. So I like to say it's about the people in our lives. It's not about the things, the doorknobs in our lives. It's about the people. And so that's a really hard message for people to hear. So I wanted to make it very plain and clear, telling people what they can do, and then asking people to not go into somebody else's house.
Mhm.
That's a really hard thing to say. Don't go into somebody's house. Don't go into your grandchild's house, your aunt's house, your mom's house. Stay in your own home. There are some exceptions that I put in the letter, but in general, what we really need is for people to keep that first and foremost, that your children and your family that live in your home should stay in your home as much as possible and not have anybody else in, and don't go into anybody else's home.
Mhm. So maybe I'll follow up with the story you shared with us about your son coming home from university. Can you share a little bit about that getting together, that reuniting?
So when I write something like this, I mean, it hits me personally as well too. So in this case, I have two children, but my one son, who's 18, is actually at the University of Waterloo, and he's staying over there in another house with a few other people. So of course you want to see your 18-year-old from time to time, and of course he wants to see you. So last weekend he wanted to come home, and I said, well, okay, but this is the rule. So when he got here, he had to, we had the garage door open. I put the car out, and we sat on opposite sides of the garage with the door open by the entrance with our coffee. I had made him lunch, and he was fine. I was wearing my winter coat. He's wearing a t-shirt, but that's for an 18-year-old. And we actually had a nice visit outside. It was good on the Saturday when we were there. I don't think it would have been such a nice thing to do on the Sunday, but really trying to do the things that are right and make sure that I'm safe, he's safe, by being outside in a covered area. Mm-hmm.
Thanks for sharing that with us, because it is about not just individuals that you're talking to and taking care of as a medical officer of health, but it is about our own individual families and what we practice as well. I have to say for myself, I have a friend who really wanted to have coffee, and we actually set a date after trying for so long. And then moderating this and listening to everything that all of you wonderful professionals have said, I had to tell her I need to lead by example. And so I can't have coffee with you. It's going to have to wait. Henry, if you wanted to visit a friend, maybe just 4 people, and all of you were a mask and totally distanced 6 feet apart, Linda asked whether the virus can still be transmitted in the room. What would you say to her? I think your mute button is still on. There you are.
My husband would like me to stay as muted. I think that's a slippery slope question right now. The guidelines say that 10 people can gather inside if they all wear masks and they all stay 6 feet apart. But I think those guidelines are going to shift and change very quickly. As I was watching the news tonight, the provinces around us and across the country are literally shutting down, closing borders, going into the red, halting any socializing outside of your intimate personal household bubble. So theoretically, that's safe, but especially if there's drinking involved, if you kind of get to the wine part of dinner and you're all 6 feet apart, you all have a mask on, unless someone is taking responsibility for making sure everyone stays 6 feet apart and keeps those masks on. And those masks have to be good quality. They have to be double layer cotton, 600 thread count with that layer of polypropylene in the middle. That's a lot to ask of people. So if you must gather, if it's absolutely a priority that you must gather, please follow the rules, 6 feet apart, that mask on. And I think someone watching as we all kind of relax and have a couple of drinks, that the distance is not breached, and be bold enough to keep people apart. That's a tall order.
Can I just also?
Yes.
Sorry, go ahead, Nicola.
Well, what we know is that as we've looked and found cases, is that even if you're in an office and you put 10 people in an office and they're all spaced out and they're just sitting there quietly breathing with a mask on, over time, if one of those are infected, we can see infections in that office. If people are talking with their mask on, like on the phone, again, we see more people infected. And if anybody takes their mask off to have a drink, to have something to eat, then the rates of infection go up. So it really is a slippery slope, just like Anne Marie said. When
Mhm.
we have seen weddings have had some really disastrous infection rates in weddings. Why?
Mhm.
Because people are eating and drinking and they have their masks off. So
Mhm.
what Anne Marie said is right. Currently you are allowed to go into somebody's house up to 10 people, but it's a really bad idea.
Right now.
Yeah, it's a really bad idea right now.
Mhm.
Yeah.
Thank you for sharing that. So some folks think that it could be 6 feet apart without a mask. And you're saying it needs to be, you need to have your mask on, even if you're 6 feet apart. And I think that's really important to drive that home. That's what I'm hearing.
Yeah, you're right. Because people, when they talk, especially if you're talking loudly, especially if you're in a room where there's music in the background and you're talking louder, the virus, it can actually go further than 6 feet.
Thank you. Helen, you have been a lead on this, and maybe you can share a bit the reason why within 10 days it was necessary to have another one of these sessions. And then I have a question for you as a follow-up.
Sure, I'd be happy to. So let's be honest. I mean, 2020 is the new 4-letter word in our dictionary. We're all pretty sick of COVID-19, right? With wearing masks and washing our hands and keeping 6 feet apart and endless Zoom meetings. We just all want life to be normal again. We know what we need to do to keep physically safe, and thanks to public health, and we have amazing public health partners with Nicola's team here in Guelph Wellington and Dr. Shuli Wong's team in Waterloo region. Many of the things that we need to do, though, are mentally very challenging for us because they're the very things actually that keep us mentally well. So things like spending time with our family, getting and giving hugs, dinner parties, sleepovers, all the things we've just talked about. So it's counterintuitive actually for our mental health in a pandemic. So sometimes doing the right thing can feel very wrong. So it's really no surprise that we've seen a resurgence of the positive cases. I think it's also important just to talk about what that means. It doesn't mean that people don't care. It doesn't mean that people aren't concerned. I think really what it means is that people are tired. They're weary of all the rules, all the regulations, all the things that keep them apart, which certainly support our mental health. It also reflects how hard behavior change is, especially because this behavior change is long lasting. This is not a short crisis.
Mhm.
So that's also very hard. It can be mentally exhausting as well. You know, when you think about our life prior to March, we would grab our keys, our purse, and our phone, and we would head out in our car and we'd go anywhere we want and see as many people as we wanted. When you look at our life now, you take your keys and your phone and your purse and your hand sanitizer and your mask and your face shield, and we have to be careful where we're going, and we have to limit the amount of people that we see, and there are so many things for us to remember and absorb. It is exhausting, and that's something that is really important for us to acknowledge and remember. It's also challenging sometimes in a community like this to see the impact of one person. So Nicola's example around a dinner party, for example, or a sleepover, we aren't thinking that that one thing might cause a spread because there's thousands of people in our community. But in actual fact, it's all of us doing that one thing, which is going to change the curve. And that can be discouraging sometimes, but we have to believe in the greater good. So we really wanted to have this session tonight because we're at a really critical crossroads. We need to get on board certainly with the public health guidelines and really embrace them. We know what we need to do, but more than that, we also need to recognize the mental health impact of this situation. We need to be patient and kind with each other. We need to show some empathy and compassion. There are a lot of people struggling in our community right now. There's a lot of fragility. And having that support and empathy is actually what's going to help us make this change,
Mhm.
which we all know we need to do, but we can do it from a place of support.
Thank you so much, Helen. And we have about 20 questions, maybe 25. So we as we go forward, I'm going to bug you. And part of my job, I'm the bad guy, to try to keep it brief if we can, so that we can get as many questions in as possible. That information is so important, Helen, that you have shared. And I'm going to follow up with the question I'm going to follow up with, because I think you sort of answered Tara, the question that she had. So I'm going to go to Anne-Marie as a physician, as a family doctor, as someone has a question, and it's more of a statement, but they have help at the end, and maybe you can give them some comfort in this. She says, it's someone says Dr. Z, I don't know who that is. My parents are late 80s. It's you. Oh, that's not you. Someone is asking the question to you then. Yes. My parents are in their late 80s, living in own home, and don't seem to fully understand the gravity of COVID. Dad still goes to his barber's home without a mask. He socializes with old buddies, and they are way too close. They don't wear masks properly. He's also a diabetic and is at great risk. Mother has dementia and doesn't understand what is going on from day to day. Mm-hmm. And this person says, I am out of ways to help them and make them understand. They're resistant to my explanations of why we cannot host a Christmas dinner for them this year. Help.
Yeah.
How would you advise a patient like that?
That's such a common scenario. It's different if your family members are in a long-term care home, because we know what the rules are there. They're protected, and in some homes you can still visit. You have to have a COVID test, whatever the rules might be at the time. When a couple, an elderly couple or a person is in their home, they're not protected by anyone else. They're on their own. In your situation, it sounds like you've done everything you can possibly do. People might not like this. I just might call that barber and say, hey, is it okay for, or it's not okay for you to allow people into your establishment? Say it in a nice way, but really we should all be wearing masks in public places, including hair salons and barbershops. So that barber may need to take responsibility for the people that are coming into his space and make sure they have masks on. And you may want to speak to the folks that your dad meets with, and perhaps discussing it with them in a group, and maybe showing them how, wherever they meet, how they can keep their distance and keep their masks on. But that is a really big problem. And of course, your parents are at higher risk if they get COVID. Thankfully, they will be first on the list after long-term care for getting a vaccine. We need to talk about the vaccine tonight, because this vaccine changes everything. It shines the light at the end of the tunnel. It will give us endurance and perseverance to get through the next 3 or 4 months, to get through Christmas. So we have to talk about that too.
Absolutely. Thank you. Thank you, Anne-Marie. Dr. Mercer, we have here someone who it's a similar question. The difference is a young person, and you talked about your son and the distancing to ensure that your son stayed safe. And so asking you this question with a son who attends Waterloo University of Waterloo, and has been home since December, planning to move into a home with 3 other young men, and he's asthmatic. He's vulnerable. She says he doesn't wear his mask properly and he feels COVID fatigue. He's resistant to following the restrictions. She's very concerned about him moving out, and with COVID numbers so high in Waterloo especially, I have a feeling it will be similar to what Anne-Marie has said. We're talking about aged parents, and we're talking about our, young children. Tell me a little bit about the vulnerability of the young now, where it wasn't, and part of your writing in that letter addressed that.
Well, definitely it's, I can feel the same way. When my son went over to Waterloo, so whoever you are, I feel your pain, because I felt exactly that myself. I think one of the things though that helped in my case was really having that conversation with them, because they feel invulnerable, they're invincible. I'm 18, nothing's going to happen to me. And you can't change that with the 18-year-old. But what you can have the conversation is about how they don't want to give it to you as a parent, and how they don't want to give it to their grandparents or any other older family members. And my son in this case will say things like, I'm not so worried about myself, Mom, but I don't want to give it to you. And so he's actually being careful. And as Waterloo is going into more of a lockdown, and they may be out of it by January, but right now they are, it actually makes it safer for everybody who lives there because there are fewer places for people to go. So I'm sure that the other family members who are sending people into that home to live with your son probably have similar thoughts and concerns. So if you're able to, maybe you want to reach out to the other families, the other parents, to really have a strategy about things like how are they getting their groceries? Maybe could you order it online or have it delivered? How are they making sure they have masks, making sure they don't have reasons to potentially go out as much into the community? Is there ways to try and impress on these young adults that their behaviors do matter? And just a little plug, I understand that the University of Waterloo will have the pan-bio testing hopefully going in shortly. So there may be, there is a testing place on campus. So if he has any symptoms, he should go to the University Health Services, get tested. All universities now, many of them do anyways, have testing on campus. And many are also looking at rapid testing. So those are changes that are coming, that are both good changes.
That's great. Thank you, Nicola. And I'm gonna, I don't know whether your volume went down a little bit, but I'm gonna ask if in between, if you have a chance to turn it up a tiniest bit. And I know that we're looking at closed caption and others, and there might be some folks who are a little hard of hearing as well. And if we're able to speak a little bit louder, that would be great. Let me just, Anne-Marie, you're chomping at the bit to talk about vaccines, which is so important. So I have a question for you about vaccine, and then I'll go to Helen.
Yeah.
The question from Arnai says, I think I'm pronouncing it correctly. My question is about the administration of the vaccine. Do you know yet if it will be a one-step injection vaccine, or will it require more than one injection for full effect? And there are 2 vaccines out now, Moderna, 3 now. I'll leave that with you.
3 are almost head to head. Yeah. Okay. So can I take the next 30 minutes and just natter away about vaccines? No, I know I can't.
Did you see the look on my face?
So I just want to give everybody a bigger perspective.
Yes, absolutely.
What's happened in the scientific community in terms of getting these vaccines ready for distribution is nothing short of miraculous. All right. It's massive. What's been accomplished is absolutely huge. These are messenger RNA vaccines, and I'm going to put in my post in the next few weeks what that means. But we've never had vaccines made from messenger RNA, which is a type of genetic material. But there's been 30 years of research, 3 decades of research that have gone into creating this vaccine. The technology has been there for a long time. What the scientists needed who were working on these vaccines was the opportunity to use it and the resources in terms of money and people to get the thing going. So this vaccine and the technology, they were made for a time like this. That's important to hear. The light is at the end of the tunnel. I don't think it's a question that we're going to have a vaccine in short order in early 2021. It's a 2-shot vaccine. The only vaccines we're seeing so far that have made it this far are vaccines that are based on that messenger RNA technology, in which case they will be 2-shotters. So far, the Moderna one is the 2 shots are 28 days apart. The Pfizer one is 21 days apart. The Oxford University one is just creeping into the headlines now, and I'm not sure how many days apart those 2 vaccines are. So this is going to be the logistical, sorry, Nicola, because this is going to be in your hands. Public health logistically is going to be really, really difficult. But if the world could get to the point where we have the vaccine available, we will find a way to distribute it to everyone. It will be done in chunks. It will be done, the first group that will be immunized, I would guess, is the highest risk, which are let's protect our folks in long-term care facilities. But I want people to understand this is a highly safe vaccine, and I'm going to outline the science behind it, and that will tell you why it's safe. The science and technology automatically makes it safe. I have no concern at all about getting this vaccine. I will be the first to line up, but I'm not the highest risk. But if you want me to give it to myself, I will do that. Please line up for this vaccine. It is going to change everything, and it's going to get us to the spring where we just see a massive light at the end of the tunnel. Did I answer that? I may not even have answered that.
I think you did. And right away on cue, what we think about the vaccine. We have a poll up. When a vaccine is approved and is available, will you take it? We asked this question the last time, and Marie and Helen, of course, and Dr. Friars that was here is hoping that it will be 95% to 100%. So I'm going to give everyone a few minutes to respond to this. You have about 2 or 3 minutes. It's a yes, no, or don't know yet. So if you could please respond to this, that would be wonderful. Will you take the vaccine when it's available? And I will go to Helen with a question. Oh, 83%. That's an increase, a huge increase. It went from don't know yet to 83%. So that is really wonderful.
Yeah.
Thank you for sharing it. We still have about 17% to work on, but we'll take that at this moment.
Yeah.
That's great. We have time.
Great.
Helen, one of the questions that came up was about someone with Alzheimer's and the challenge that they face with their parents and with providing a really safe space for someone with Alzheimer's. We know how much the mental health impact of COVID-19 of people who are lonely. How would you respond to that?
Well, so it's a great question. And, certainly we see seniors in a very high risk category, whether they're well seniors or seniors with physical issues or certainly dementia. My heart goes out to people who are struggling with parents with dementia. It is heartbreaking at the best of times. And then never mind working through a pandemic where you're constantly having to repeat messages just to keep your loved one safe. Mm-hmm. It's incredibly challenging. So I would really say that we have some amazing partners in our community. I can think of the Alzheimer's Society, for example, that they specialize in dementia. And I think there are times like this that you need to really consult with people that are specialists who can help you with very dementia-friendly strategies. Sometimes people, they end up doing the wrong things because they don't know. Mm-hmm. For example, I will just say that sometimes with people with dementia, they often regress. So they'll talk about their times in the past and they think that those times are now. I actually used to work with people with dementia very early in my career at St. Joe's. And one of the people I worked with used to introduce me as a bridesmaid in her wedding. Well, she was 97 and I was 22. So obviously that wasn't possible, but it wasn't important for me to correct her. Mm-hmm. And I think sometimes that can happen. And what we want to do is really provide calm reassurance and support. Mm-hmm. And I think through the Alzheimer's Society, you learn strategies, you learn ways of coping. They have whole kinds of messages around how to deal with the pandemic as well. And those are really important things to bring those folks in. Calm, reassurance, support, keep routines, and of course, bring some respite as well, because caregivers definitely need a break.
Thank you. And you mentioned the pandemic, that they have strategies around how to deal with the pandemic. And that might be yes. something that others don't know, that they also are looking at what you can do during COVID-19. And of course, you mentioned the routine, that some of those routines are continuing. Unfortunately, the routine of Christmas getting together may not happen this year. And what this person has said is that it might be the last year for her parent. And she sadly has to forego Christmas, but it's safer to forego Christmas than to risk the person being infected with COVID-19. So we thank you very much for providing this information to us in this question. I think it was Tara. Thank you, Tara. We look forward to speaking with you again. And here's some rapid questions that I'm just going to throw out very quickly that we can get through. I'm looking at the time at 7:35 already. Where's the time going? This is for Dr. Mercer. What is the status and your view on rapid testing?
I think rapid testing is a great idea. There's two different types of rapid tests, though. There's the kind that help diagnose if people have symptoms, and those are probably more relevant for rural areas or northern communities where locally we have very good service in terms of getting our testing through our assessment center. For anybody who's listening, you can make a same day appointment, and they do have spots. It's a great service in Guelph. The other tests are what we call screening tests, and those are quite different. And those are right now the Pan Bio, but there's also going to be a number of others that are going to come on the market rapidly. And those are really game changers. Those are ways of being able to screen people who don't have any symptoms, who feel well, who are in a workplace or a school, and in 15 minutes know if you're positive or negative. They do have a slightly high false positive rate, which is okay. Just means that there'll be a few people that screen positive that will go get the test and aren't positive. But all in all, it's a great way of knowing that people in an environment such as a classroom, a sports team, a workplace, that everybody there is screen negative.
Thank you. And Anne-Marie, is it fair to say the social bubble concept no longer exists? It says 10 people not necessarily from the same household committed to the bubble.
Nicola, I'm going to say it does exist because it's still in place as a guideline.
I'm going to bug you both and interrupt you both for a second with the volume. I'm going to go like this when the volume needs to go up. Yeah.
Okay. Can you hear me now?
Yeah.
I think that as we said before, the guidelines say it's okay, but cases are on the rise. Cities are going into the red, provinces are shutting down. I just don't think it's safe to have 10 people inside your house. I just don't think it's safe. If you have to do it, wear a high-level mask, material or surgical level 2, and stay 6 feet apart. Have that one person keeping a close eye on things. So there's what the rules say, and there's what I mean. I think the rules cannot shift fast enough for how quickly this virus is shifting and changing.
I have to agree with Anne-Marie that what the rules say does not necessarily mean what's in your best interest or in your family's best interest. And so I would encourage people to not have people into their homes who they don't live with. Every person who comes into your home is a risk. People are getting this from their friends and their family. So I absolutely agree. The concept of bubbles, people don't get it anyways. They think I have a school bubble, a gym bubble, a work bubble, my social bubble. There's too many bubbles. It's what I want everybody to do is think about all the people in their life and have less contacts with all of them. Do it virtually or stay far enough apart, more than 6 feet, wear masks, be as rigorous as you can to protect yourself from your friends and your family.
And this is probably a yes or no answer. Dr. Mercer, schools are providing non-medical, non-sterile masks to staff. Are we safe?
It's my understanding that the teachers are provided with medical masks in schools.
Okay. If Guelph is in orange level, should we avoid traveling to areas that are lower levels, like yellow? My mother lives in a yellow area, and I wondered if I could visit her outside her house. But is that a bad idea?
Is that to me or is that to?
Go ahead, Nicola. I'm answering a question online here.
Okay, I would say if the intent is you're going to visit outside her house, then I'm okay with that. I think that that is, your mother probably needs to see you. That's good for her mental health, and it's safe if you are outside the house. I would just say though to everybody that's listening that if you are in a red area, for example, we know that some people in red areas are coming to Guelph to shop or to use our restaurants because they're open. That actually is putting increased risk to our area when those things happen. So I think we need to be really mindful that if you're going for the purpose of essential visit or to give compassion or to give to support somebody, and you can do so safely, that's very different than if you're going to shop.
Someone was asking, how does someone know if they're asymptomatic? But I guess if you're asymptomatic, you don't know unless you get tested. Yeah. So does that make sense? Yeah. So I will. Hey, I answered a question.
That's great.
Not part of my job, but I did, because we have about 40 to get through. No, we're both 30 to get through.
Yeah.
And you already answered the question. Someone said, I have friends in the hot zone. Can I go hiking with them? And what you just said is that we need to, if we know with certainty, we need to sort of stay away. Of course, Helen, you might have some comments if you're hiking at a very far distance. I guess at hiking, you can be more than 6 feet apart. Would you say the mental health part of it? Who would like
Yeah,
to take that one?
I think that's always what we have to manage, right? In terms of we're constantly making judgment calls and managing the risk. And there are people who, that is part of why we're seeing an increase in surgence of COVID cases, because people are so tired that they're saying, forget it, I'm just going to go out. So we have to find ways to meet the needs of those folks so that they're not putting themselves at risk and putting other people at risk as well. So there's many things that you can do while still staying safe. So that's part of our challenge right now.
Anne Marie, had something to add to that? You look like you were.
Well, I was, do you want to do the check?
Poll is
Yeah.
up. How are you doing? We want to know how folks are doing as we go forward. Are you struggling? Are you thinking, man, are you doing okay? Are you all good? Just if you take a minute or two to respond to that poll for us, that would be wonderful. I have a question in the meantime until the poll results come up. Are we seeing transmission in personal service settings aside from the Kingston Nail Salon in June?
I guess I better answer this one.
Yes, please.
There have been some very few. So it's not that it's zero, but it is actually quite low. So in general, personal service settings, because they are, and I think the Kingston example was a real wake-up call for personal service settings.
Mm-hmm.
Keep your mask on, keep it on at all times. You're not allowed to take your mask off for anything on the face. Yes, and so if you are going into a hair salon or a personal service salon and everybody wears a mask, and keep it on and spend just the amount of time that you need to be there. Don't socialize. And we haven't seen the surge in cases. Some cases, but very low.
Mm-hmm. Thank you for that. And here are the responses. 14% says I'm struggling. May is about 29%. And I'm okay actually is 47%. And then all good is about 12%. That's sort of similar to what we heard about 10 days ago. It's good that it hasn't gotten worse. And we recognize that, that there are challenges, that people are facing challenges. So that's why, you know, having these kinds of conversation discussions for our community is so important. Thank you all for responding to the survey and responding honestly. We really appreciate that. Someone asks, Anne Marie, how long will we need to do these strict guidelines?
Oh, that's going to be a guess, but that really depends on our behavior. I'm worried about Christmas. It would be nice to talk about that briefly, so we can help people figure out how to have Christmas safely. But if people do not follow the guidelines over the Christmas holidays, and then we bang into New Year's, there's going to be a third wave. I just think we're going to see the second wave do this, and then the third wave is going to hit us, if that's what we're going to call it. And if that happens, I believe we'll go into lockdown. And that's how important it is for us to get back to following the guidelines. Be strong. The end is in sight, but we're at high risk in the next little while if we don't follow the guidelines. Nicola, what do you think?
Yeah, I think that exactly what you say. I'm concerned, very concerned. Like but I have hope.
Mm-hmm.
If our community, they wrote that letter, and if people actually change their behaviors, if they decide that I'm going to forego that birthday party, we'll put it off. We'll maybe not have dinner with our friends. We'll do something virtual. Maybe we'll go for a walk instead of having a coffee, and we'll stay 6 feet apart and wear a mask. If people change their behaviors, it will take 2 to 3 weeks before we'll see a difference, but it's not impossible to stop this train wreck that we're on in our area. It's going to be difficult, but I think it is still possible. I know for some areas like Peel and Toronto, they are just, they're overwhelmed right now, but we can make a difference individually. I really want to say that it is, and we can keep our businesses open and our restaurants open if we just make some changes.
Can I make a comment too, just to remind everybody who is living in the Wellington-Dufferin-Guelph unit area, that Nicola was the first public health medical officer of health to put mandatory masks in place. She did that in June, way ahead of everyone else.
Yeah.
I think that's why we are in such good shape in this region. Outside of North Wellington bringing in some cases, our numbers are very low, and our percent positivity in R value would be low too if you took out the North Wellington cases. She is brave, she's courageous, she's smart. Follow her. So read that letter and be courageous. It's going to be so hard, but we may not be able to control what the rest of the province is doing, or what the red zones are doing, or what other provinces or countries are doing. But in this area, if we focus on our leader, we could have a much easier Christmas and not go into lockdown. That puts at risk here. Yeah.
Yes. We need to stay out of lockdown. And speaking of
Yeah.
staying out of lockdown, Helen, with COVID fatigue being contributing factor to rising cases, any suggestions on how to manage discussions with family members to help manage positive relationships and keeping the peace while adhering to the guidelines?
Yeah, it's a great question, Marva. And I think talking to each other right now, especially while we're all fatigued from COVID, is so important. Every single one of us is impacted by this pandemic, and we all need to share our common experience, our feelings. It actually really helps. I think it's also really important to help each other think differently. This is not easy to do, but it's really essential. So for example, when we think about our holiday season coming up, for example, if we think it's going to be terrible, then it will be. But if we go into the holiday season knowing that we're going to make the best of it, we're going to be staying apart, and that's actually the most loving thing that we can do for our family. That's going to help us get through the holiday season, right? Some of it is how we're approaching this mentally as well. I think the other thing we can do is really support keeping our family members and each other grounded, and finding ways to do that. You know, we can do some mindfulness together, some meditation together. There's online yoga classes. There's all kinds of things that we can do to support each other, because this is a really stressful time. And most importantly, take a break from COVID as well. It's overwhelming, it's stressful, it can be all consuming. Turn off the TV, turn off the radio, play a board game, have some fun in the kitchen, making a new batch of cookies. Just enjoy your family time as well.
Thank you. Thank you, Helen. Nicola, given the science now confirming aerosol transmission as a primary means of COVID spread, as someone says, SPINKO, long-range transmission on trains, etc., how has public health pivoted with regards to its policies in schools? And they're asking specifically, how have protocols changed with regards to 25 plus kids eating indoors for 40 minutes unmasked? And someone asked, this was a separate question from this one, is there a way that public health would mandate only 15 students per classroom? This is sort of a loaded question for you, Nicola.
Yeah, thanks. Emery, over to you. No.
Okay.
All right. First of all, I have to make a correction. And the question started with the premise that aerosolization is the primary way that this virus is transmitted.
Yeah.
And that is not correct.
Okay.
So what we do know is this virus can be aerosolized. Absolutely. There's no doubt about that. We know that the virus can go further by simple things like singing, shouting, projecting your voice. Those are all high-risk behaviors, and the virus can go further than the 6 feet. And there have been lots of studies of aerosolizing the virus. For the most part, though, the studies have shown that you have to have certain conditions, so rooms with fans or air conditioning, or very dry, so the virus particles actually sort of desiccate a little bit, so they will go further. This is still an ongoing question, but what we can see is that when we see transmission occurring, it is occurring in close contact situations. So there's been some lovely studies where people were in a car, long distance. In fact, there was a fellow in a car. This is a case in China where he was in a car for a long time and nobody in the car was masked. Guess what? Everybody in that car got COVID. He got into another car. Everybody in that car was masked. And they did another journey. No one in that car got COVID. So what we can see is that that this is a virus, that masking is a really effective way of not just protecting others, but protecting yourself. So the question then goes back to schools. So what are we seeing in schools? Well, funnily enough, I actually just had a phone call today with Minister Lecce and with all the chairs of our local boards of education. And what we see is that children come into the school with COVID. They get it at home. And so by getting it at home, then they bring it into the school. When they bring it into the school, we find it, we send them home. Sometimes the class goes home. But we have seen across the province very little transmission of COVID, very little, even with positive teachers. So the kids, you're right, they sit there. Most kids don't take 40 minutes to eat, but they do have that as their maximum. So they do have their masks off, they go outside. So whatever the schools are doing, and we know it is, all the policies and the protocols, they really are working. I think a lot of us thought maybe they'd work, maybe they wouldn't work when we put them in play, because there wasn't a lot of evidence. But if you look around the world at children in schools, to everybody's shock and surprise, it's actually working out a lot better. So the concept of aerosolization for schools, that's still an open question, but currently doesn't seem to be the main mode of transmission in schools. Sleepovers, I have to say it, it's sleepovers and play dates. That's the way kids get it.
And speaking of schools, there are a number of questions about students coming home from university and parents feeling that they don't want their child to be alone, to spend Christmas alone. So here's one question that I think adds to all of those questions, but it might end up providing a good response overall. A few friends have mentioned that their families will be quarantining for 14 days prior to Christmas, pulling kids from school earlier so that they can get together with family members outside their household, so grandparents, etc., for Christmas. What are your thoughts on this? Is this safe, Anne-Marie? Or Nicola looked like she's ready to answer it. Anne-Marie, you're gonna have to tussle for the response to this one.
Go ahead, Nicola, because I'm answering online again.
Okay, well, let's look at the science first. So what we know from the science is that you can, let's just say right now today, somebody gave me COVID, I got it today. I know that I may not develop symptoms for up to 14 days. The average is probably 5 to 7, but I may not develop symptoms up to 14 days. So let's say after 14 days, on the very last day, I start to get very mild symptoms. I am now infectious for 10 days. So the concept that you could pull your children out of school for 14 days of isolation and then you are safe has the one flaw that if people are symptomatic on the 14th day, they'll be infectious for another 10 days. So if you ask me, I was isolating for 24 days, would it work? Well, it might, but who's going to really isolate for 24 days? That's a long time. And we do not have the capacity in the system. In fact, you can't even go and get tested on day 14 because you have to have symptoms to be tested on day 14. So the flaw with the plan, and believe me, I think it's what you're planning to do is something that, even I've thought about, because I have a son at university too. I think a lot of people are thinking about, but there is a flaw. So in that you could be very mildly symptomatic or asymptomatic at the very end of that 14 days. And so you wouldn't be safe to go see your grandparents and stuff. So that's the challenge.
Okay, thank you for that. Thank you, Nicola. Helen, could you speak to the inconsistency for teachers who are being asked, because it's a mental health question as well, to teach to a classroom full of children, work alongside colleagues, have children remove masks for nutrition breaks, and then go home and isolate at home? The question is, why is this a safe practice at school and a reasonable expectation for mental health for the teacher who's exposed and then subsequently isolated? And Nicola spoke to children and the transmission, which we're finding that it's lower than we expected it to be. This is talking very much about the mental health piece of being exposed to children and then having to go home.
Yeah, I don't think there is an easy and simple answer to that, Marva. I think fear and anxiety play a big part of what we're all living with. And until there's a vaccine and until next year when transcends into our community, this is really the space that we're going to have to be living in. COVID is part of our life right now, unfortunately. I will tell you that my own staff at CMHA struggle with this because we provide face-to-face care as well. And we are doing our best, like the school boards are doing, to keep our staff safe, to follow all the public health guidelines, but we still need to see people face to face because that is part of our responsibility to the system. Teachers play such an important role because they keep our system stable. If we don't have teachers right now, if they're not at school, there's a lot of kids that need to be at home, right? So like mental health workers who help keep the mental health system stable, teachers do the same thing. So we want to make sure that we're supporting our teachers with their anxiety, with their fears, with their worries. We're doing absolutely everything we can to practically keep them safe. And I know the school boards are doing that. That's part of what they're, learning and growing all the time. We know so much more than we did at the beginning of April, for example. We're getting wiser and smarter and understanding this virus so much more. But the reality is we are living with it, and we have to be able to find ways to support each other and work through those feelings of anxiety and worry.
Thanks, Helen. Nancy has a question, and Nancy, I'll say she's a friend of mine. How does one reconcile the challenges of restricting in-home visits for people who live alone? That's a really tough one.
Mm-hmm.
Yeah, I think they're allowing in that situation for people to get together and be safe while they're doing so. The isolation for people who live alone is just as much of a risk as COVID-19. So correct me if I'm wrong, Nicola, but I believe that it is acceptable for people who live alone to actually join another bubble or to receive visitors safely.
Yeah, I think both is really important, the concept. And even in my letter, I talked about, essential visitors. For people who work, if you're not retired, if you still have a job to work, Marva's giving me I got to speak louder, sorry. For people who have an employer, one of the things I also want to suggest is that you talk to your employer about not working from home, or at least not working from home all the time. Because for some people, if you live alone and work alone, it becomes really hard on your mental well-being. So that is also one option on the table. And then it is also, and we do encourage people who are singles, who are living alone, to find another single or another individual who's living alone, and you become a family unit so that you can actually support each other, that you can actually see each other as if you were in the same home. Because you're right, we're not telling people that you have to be in isolation for a year.
Thank you for that. Eliza has a question having to do with in Wellington, Dufferin and Guelph County. She says we are in the orange. Where do you see our region headed? Staying where we are, or are we in danger of falling into the red anytime soon? Can we say that was answered if we practice all of what we're being told to practice? Then we could stay in the orange and maybe even go to yellow. If we don't, we're going to red.
I think that's fair to say. I also think it's really important for people to realize that what we see today, the cases we see today happened 2 weeks ago. So if we start practicing new behaviors today, please don't be discouraged if you don't see anything happening for the next week or 10 days. It takes a couple weeks for everything to ripple through the system. So people's behaviors today will start to show up in the middle of December. So I just want to encourage people to not lose heart. We still can turn this ship around.
Okay, that's great. Another question is having to do, and because we talk about teachers, Helen and everyone else, Nicola and Anne-Marie, we talked about the important role that teachers play, not only in this session, but in the previous session, we talked about that. A fair number of questions from teachers and others who are in education. And this other question is similar to the one before. Having trouble reconciling public health messages with the day-to-day experiences of working in an elementary school most of the day in a crowded room where students need to take their masks off to eat. And so maybe, I don't know whether this means something going out or Or how would you answer that, Nicola, just to reinforce what you had said before?
Yeah, well, what we have seen, and it does happen, is we have seen teachers get COVID-19, but if we look, almost without an exception, they're coming from the community. So they're getting it at home and bringing it in. We're not actually seeing it within the school. So we have a few examples across the province, but if you think of the tens of thousands of children that are in school versus and the teachers, what is really quite remarkable is what's not happening in our schools. So what we're seeing in our workplaces is much worse than in our schools. And when we do have had a few problems in the schools, again, it has almost always been in the lunchroom where teachers are socializing with their colleagues. And then that is not just true of schools, it's true of our hospitals, our long-term care homes, our workplaces. We forget, that we that it's our friends and our family can still give this to us. They don't know they have it. It's a common source of infection.
The virus likes it when we're together, and it doesn't matter where we're together. If we're together, it loves it because it can transmit. It can't survive on its own. It needs a host, and we're the host. I heard someone say recently too that in schools, even though kids may not be 6 feet apart, number one, kids do not seem to transmit as easily. They're not the super spreaders we thought they were, and that wearing a mask, looking ahead at your teacher, not speaking to kids around you, and not speaking in general, only being a meter apart, is protective, and the transmissions are not happening even though there are not strict public health guidelines being followed. Kids are eating lunch, but they're not talking and they're not close to people when they do that, and then they're going outside for recess or the lunch hour. In terms of workplaces, and Nicola, could you confirm this? Most of the transmissions in the workplace are happening in the lunchrooms, in the hallways where people are stopping to chat, and in the kitchens. It's safe to go to work if you wear a mask and keep your distance. For the most part, those transmissions are occurring in public areas where people are not adhering to the guidelines.
That's true. The other place that we are seeing it in workplaces is noisy workplaces. So frequently it would be lines or where people are working on in a very noisy environment. And often we see this with, in particular, our men who are doing heavier jobs. So sometimes they are getting closer than the 6 feet. Men have this really nice habit of wanting to wear a gaiter. That's a very thin mask that they pull up and down over their face. Gaiters are not protective. Don't wear a gaiter. So if your husband's wearing a gaiter, stop him wearing a gaiter. They don't protect you or him. So we do see it in some of our very noisy workplaces that are locally, and it's all to do with speaking loudly, getting very close, and wearing inappropriate protective equipment, not wearing a mask.
Yeah.
And speaking of masks, this is for anyone. The last time I think we responded to this, but we have lots of people on the line now. Where do we get polypropylene? And will coffee filters do as a third layer while they source polypropylene?
So coffee filters are not as effective as polypropylene, but they're better than 2 layers. Remember that in the 3-layer mask, the cotton is very important too. It has to be a heavy, high quality cotton. Try to find a 600 thread count or more. And that's not necessarily easy to find. That's not all cottons that you find. Look at the thread count if you're purchasing material from Len's Mill Store. The last I heard, Len's Mill Store still had polypropylene. Craft stores, if you're not living in our area, tend to have polypropylene. People who are making masks with polypropylene, like Hides and Hand in Rockwood, have sheets of polypropylene, and you may be able to purchase it. You can also purchase it on Amazon. I don't like people using Amazon. I think we should support our local businesses. And I'm not confident. I've looked on Amazon. I'm not confident it's good quality, but I am going to try to purchase some just to see if it meets the grade.
And I think someone said Len's Mill Store and Fabricland possibly has polypropylene as well. So Len's Mill is local, so we could be able to get some there.
Yeah.
There are several questions that has to do with family dynamic. One, it was so complex that I think it might be one that Anne-Marie answers as she's typing stuff away. This one, we will try this one. We are co-living family, and our adult niece has not been able to bring her longtime boyfriend into our house until 2 weeks ago, when we said he would come into the basement only and use the downstairs bathroom. Now I'm feeling like that isn't a good idea and that we need to go back to the household members only. I feel bad, but it does concern me greatly. They are together at work and his house, and so far we are all okay, but still I think we need to return to this protocol. Is this person being overly cautious?
Can I just clarify? It sounds like they're actually living now. They moved into the basement 2 weeks ago. So what I would say is, if somebody has moved into your home and it's been more than 2 weeks, I would continue to watch them for symptoms, at least for another 10 days, and then they can become part of your household. They are now in your house. Mm-hmm. So I think that they have to follow all the same precautions. So they can't go back to another household and then come back to your household. So they become a part of your household if they move in. So just for those of you, I mean, many of you who are listening probably have known that people move into long-term care homes, retirement homes, people move around, and we have to have safe ways to take somebody who's in hospital and put them into a long-term care home or retirement home. So when they go into those homes, they get tested and they go into isolation for 14 days, and then they're tested again, and then they can go back out into the community. So there are ways to move people around, and so if somebody's permanently living in your house, they become part of your household.
Thank you. And what are your thoughts on team sports right now with increased numbers in the communities? Anne-Marie?
Oh, I'm answering again. Can we put that? I'm
all right, I'll answer that one.
Yeah.
Team sports have been one of the areas where we have consistently seen outbreaks with cases. Mm-hmm. So many of the sports teams right now are practicing, so meaning that they're sort of staying apart and they're just practicing and they have no contact and they try and keep physical distancing. But we have so many outbreaks that across the province that can be associated with some kind of team sports. Some large pickleball seems to be a very problematic sport, which I would never have guessed. I don't know quite what people do who play pickleball that get COVID, but so what we see is, and it's not just the sport. So sometimes the sport can be played quite well. So perhaps tennis, one person on each side, many feet apart. However, what you do before and after make a big difference. So that's the same way with hockey too. So as we are going into, like, Waterloo's going into red and the surrounding areas going into red and we're in orange, sports events which put people into close contact where they're breathing deeply and they're not always wearing a mask, these are all high risk activities.
Thank you. This one, the Consulate General of India will organize a camp, and I'm assuming it's a little party of some sort. We will observe distance, put on masks and sanitize and wash our hands. What can we do to be more safe? 6 feet apart, maybe?
So this is a camp?
The person said a camp, and I'm not sure what camp means.
So let's just sort of take it apart. What we know is that if you're spending time around someone that's not in your own household, that you need to be at least 6 feet apart, wear your mask at all time and wash your hands. Now, if you're going to a camp, a lot of camps are overnight. And so you're actually going somewhere else to stay. And you may be having like a common dining hall or a conference where you're sitting in close contact. So you have to really understand what is it that you're signing up for, because all of those activities can put you at increased risk. Anytime that you are around somebody and you don't have a mask on because you're eating or you're drinking, or you're in a room for a prolonged period of time, somebody you don't live with, those are all places that you can get the virus.
Thank you. We have only 5 minutes left before we wrap up. Time goes by very quickly. We had more than 70 questions, and so that makes it challenging. There's one question about school buses, where there are a couple of questions actually, where they feel that there's no distance within the school buses and masks are halfway down. Does public health can public health comment on that at all? And
Well, we
Nicola?
certainly have, with school buses, we certainly have had to follow up with cases that have occurred in schools. I'm not aware that we've had cases that can be attributed directly to the school bus, but we do, when we have a case in a school, if the child's been on a school bus, we do follow up and send the children home. So children on school buses have to sit in the same seat. We try to cohort the children by families or by classes, and right now we haven't had significant evidence of transmission on school buses, but of course, any enclosed environment where kids aren't wearing a mask could be a problem.
And a couple of suggestions very quickly. Someone is suggesting the frequency of washing masks. They see people reusing masks all the time and not really following that protocol. And the person is suggesting that that be one of the education piece that might be missing in the frequency of use of masks. So that's a comment. A comment is to have another one of these, but before Christmas, for the holidays, and make it as soon as possible. That's really important. And grocery stores not wearing masks. We know that there would be a bylaw, and someone is suggesting that, you know, if it's a grocery store, sometimes there are people that have reasons why they don't wear masks and they might have an exception. But if that is happening with regularity, I think it's a matter of speaking to the store about the mask policy. Is there a bylaw though?
When it comes to masks, the other thing I want to say is when we first introduced the mask orders for people to wear masks, we did so because my mask protected you or protected others. What we now know, though, is that if you wear a good quality mask, just like Anne-Marie said, with 2 layers of cotton and polypropylene, or some people are wearing medical masks, but if you wear a good quality mask, you are actually protecting yourself. So if you are an individual who is not wearing a mask, if you are unable to wear a mask, you are putting yourself at risk when you go into public areas. So I encourage you to take advantage of, online shopping, trying to pick your things up, try to choose less busy times of day, because the mask is not just protecting others now, we know the mask protects ourselves.
Thank you.
Can I say one thing about washing the masks?
Mm-hmm.
I think it's a good idea to have several masks and be safe, wash it every day. If you've used it that day, I just put mine in the hot soapy water before I do the dishes. And I let it soak for a good 10 minutes, give it a shake, let it soak for another 10. And I'm putting the polypropylene in the same hot soapy water. Then I rinse the mask out, let it hang to dry, and just put the polypropylene in my dish rack, actually, where it can dry there. And the safest, if you've used it during the day, wash it at night.
Mm-hmm.
It's the safest way to do it.
Marva, I'll just add one more thing as well, not relating to masks, but we are going to have our next webinar in December, but I really think it's important that we start to think about the holiday season before then. What I would just really encourage people to do very briefly is to take control of your holiday season. Don't let holidays become something you dread now. Moving into the holiday season, with a little bit of planning and some positive thinking, we can all find some peace and joy this holiday season. So part of it is just already starting to shift the way we're thinking about it and taking control and planning for it. We'll talk more about that in December, but I really just wanted to make sure people were starting to think that way.
Thank you, Helen. I think that's Helen's wrap-up comments. Dr. Mercer and then Anne-Marie for a wrap-up. We have a poll while you're thinking about that. When I think of the holiday season, I am super sad and upset that it won't be the same, that it will be different, but we will figure it out, or it will be fine. Or lastly, hated the holidays anyways, can't wait for Netflix and chill. That's the mental health poll, and we will go to that. Maybe Nicola, your closing comments, probably about 30 seconds if possible. I'm looking at our time at 8:15. I think you're on mute.
Sorry, Christmas will be different this year, but that doesn't mean it has to be a bad Christmas. And I really encourage you to think about planning your Christmas so that next year everybody will be there. We really don't want to spread COVID to vulnerable people.
Mm-hmm. And thank you so much. That's great. The poll has said 75% of the respondents said it will be different, but we will figure it out. And that's just followed by "it will be fine." So that's a really good thing. And I just want to say, Anne-Marie, do you have a few seconds for closing remarks?
Yeah, I have an idea, actually. I wonder if people who may be following the Facebook posts could comment on the next one, which I'll probably get to tomorrow, and just give me ideas of how they're thinking outside the box, what they're going to do for Christmas. And maybe we'll start a conversation online about tips and ideas to still make it special and enjoyable, because the next webinar may be too close to Christmas to actually make those adjustments now. And I think a comment section like that can really encourage us to know we're all in this together. We all have to have a different Christmas, and we can be very creative and innovative around how to make that a good event this year.
And we'll attempt to
I would
answer.
also just add to build on to Anne-Marie's comment that, you know, I started off my comments earlier by saying that 2020 was our new 4-letter word, but I'd really want to shift us to say the 4-letter word I really want us to focus on is hope. We know there's a vaccine around the corner. We have to hang on to our hope. There's a lot of things that we can be doing to support each other to get to the finish line safely. We're almost there.
Awesome.
And so what I'll do is, wonderful, excellent professionals here. I will turn it over to Tracy for our final closing remarks. I think December 14th at 7 is what we have on our calendar. Dr. Mercer, it's been such a pleasure to have you here with us. It's been absolutely, absolutely wonderful. More questions that we can answer. Tracy, can I turn it over to you for closing?
Yes. So thank you so much. First of all, Marva, thank you. You do a marvelous job of reading the comments and navigating conversations and making sure that people have been heard. So thank you, Marva. And Nicola, for all of your work that you're doing, that people don't see what you're doing. You know, we're all in our homes and living our daily lives, and we don't see the hard work that you're trudging through. So thank you so much, Nicola. And Helen, your little words of wisdom, I want you to know, even from the last session, you said, you know, find a craft and do something that you haven't wanted to do because you kind of keep those hands busy, and that inspired me. So thank you for your wise calm. You have a beautiful calming way, and so does CMHA because of your leadership. So thank you so much. And Anne-Marie, for your daily posts. People wait for your posts. And I know that that takes you a long time to write each one because they come from your heart. And so thank you. Thank you for all your time and putting those posts together. So this time together isn't about just between 7 and 8:15. It is for us listening, but it's not for all of you. And so thank you, not just for this time tonight and the past events, but all the time that you put in between each time to keep us on the balance of COVID. So thank you so much. Thank you so much for everybody for tuning in. We hope that you're hanging in there and you got some hope. And I know we certainly do. So we'll see you on December 14th at 7, and sending much love to everybody. So hang in there, everybody.
Thanks, everyone.
Thank you. Thank you, Nicola.
Thanks, everybody. This was great.
Bye-bye.
Thank you. Thank you, viewership.
That's right. Bye-bye.